Hi, good afternoon. Thanks for joining us. I'm Amanda Bednar, part of the team here at Cooper University Healthcare, and I'm here with Dr. Kimberly Hurley, a podiatrist with the Foot and Ankle Program at Cooper Bone and Joint Institute. Today we are sitting down with Dr. Hurley to talk about bunions and hammertoes and what options you have to treat them and to have a pain-free life. Dr. Hurley, thank you for joining us. I know the weather is starting to turn. It's going to be nicer. People are going to be wearing their flip-flops and all that fun stuff. So this is a really good time to have this conversation. So again, thank you for joining us.
Thank you for having me.
Let's get started with our first question. So tell me a little bit about how you got into podiatry. Why did you choose the field?
So I graduated from undergraduate school, and then I took a year off and worked actually doing lung cancer research. And I was working at Georgetown Hospital and trying to figure out what I wanted to do. And I decided that I didn't want to do that. So the doctor that I was working with told me I could go and kind of explore the hospital and meet other physicians and see what they were doing. And I met some podiatrists who were working at the hospital there, and I got really interested in what they were doing. They had a good mix of being able to do surgery and treat patients in the office, do procedures, and still had a good work-life balance. So that's how I got interested in it.
Great. Well, thank you. So let's get started right with bunions and hammertoes. So we are going to talk about bunions first. Dr. Hurley, can you describe to us what a bunion is, how it's formed?
Okay, a bunion is a deformity that happens at the big toe joint most typically, and it's where the big toe starts drifting over towards the outside of your foot, and you actually get a bump on the side of your foot and your big toe drifts over towards your second toe. And this can happen at really any age. Sometimes it happens to children, and that's called a congenital deformity, or a deformity that comes from birth. And then you can also have an adult onset bunion.
We've got several questions that have come in about bunions, so let's get right to them.
Okay.
So I think one of these, I don't know if it's a myth or a fact, but does wearing high-heeled shoes cause bunions?
So I would say no. Your shoe choice doesn't cause a bunion to happen. It just can exacerbate the problem. So people who wear high-heeled shoes or tight-fitting shoes will just notice the symptoms may develop more rapidly, but really a bunion happens because of the shape of your foot and the structure of the underlying joint. So it's going to happen to you kind of no matter what. It just might speed up the process depending on the kind of shoes that you wear.
So the point of the toe doesn't really make a difference, or how about the heel?
So I think like if you wear a pointier toed shoe, it just might exaggerate the symptoms that you already have a bunion there and make it more painful, or it might put more stress on the joint and over time speed up the deformity that was already going to occur. And really the thing that I stress to patients the most is that if you want to avoid having pain in the front of your foot, avoid the development of a bunion deformity, you should really wear a heel on your shoe that's less than 2 inches in height, because that puts a lot of stress on the front of your foot.
Okay. Does the width of the heel make any difference? Like I know there's like the skinny heels, the more pointier ones, or one that's a little bit thicker?
I mean, ultimately, wearing a wedge or a wider heeled shoe just gives you more stability, and it causes the muscles in your foot to have to do less work to stabilize your arch and to stabilize the tendons and the joint in the front of your foot. So ultimately, the more weight distribution you have across the back of your foot and the arch, the better off you're going to be. So yeah, I would say a wider width shoe or a wedge is better for you.
Okay. What are some of the symptoms of a bunion?
So most patients complain about a throbbing toothache-like pain in the big toe joint. A lot of people will complain of just pain on the bump itself. Some people will complain of a sharp stabbing pain in the joint. And then some people complain that it's not so much the joint hurts, but that their big toe is bumping up against their second toe, and that's what's painful for them.
How is a bunion typically diagnosed?
So it's a combination of a physical exam that we do in the office and taking x-rays from people.
If a bunion kind of goes untreated, I know there's been, a couple of my friends have talked about, oh, I shouldn't get my bunion treated right away. I should just kind of wait it out because that was what was recommended to them. Is that something that people should do? Should they wait it out, wait till it gets really bad, or?
Well, I mean, I think that it's one of those things that's definitely a personal choice for people. I never tell people they have to have their bunion fixed, but I do talk to people about the decision to have surgery and when they might want to come to that decision based on the fact that this is a progressive deformity and it's going to get worse with time. So while I never tell people, oh, I'm looking at your bunion and it's really bad and you have to get this fixed next week, because I do tell people, if this is affecting your quality of life, you're having a lot of pain, you should consider getting it fixed because it's only going to get worse as time goes on.
Okay. Is surgery the only option for fixing a bunion?
I would say surgery is the only definitive fix for a bunion. So there's lots of things that we can do to help people's symptoms, like giving them a steroid injection into the joint, telling them to wear wider shoes, putting pads in their shoes, even giving them an insert to wear. Mm-hmm. But none of those things are going to fix the underlying problem, which is actually a deformity with the bone. So really surgery is the only way that we can make your foot straight and fix the underlying problem.
Give that relief.
Yeah.
And you touched on this already about the non-surgical options. Can the type of shoe also work as well with some non-surgical treatment? I know you can buy, the orthotic type shoes.
Right. Yeah, I would say depending on your foot type, definitely shoe choice can make a difference. I think the challenge that probably affects most people, and probably women more than men, is the kind of shoes we have to wear. So, sometimes people have to wear dress shoes for work, and there's not a whole lot of options when it comes to dress shoes. And sometimes people have to wear like steel-toe shoes if they work in an industry. And sometimes those can be tough too, because you need a shoe with a wider toe box and something that's not going to rub your big toe joint. So while we can make recommendations about shoe modification, sometimes it's not really an option for people.
How is the surgery for a bunion? Is it painful? Is there a long recovery time? What's that surgery like?
So there's more than one procedure that you can have for a bunion, and usually we make the decision on what surgery you're going to have based on your x-ray. Most of my patients who have surgery have as an outpatient procedure. It's not typically a very painful procedure. We're able to do it under monitored anesthesia, which is an anesthesia where they just make you sleepy with medicine through your IV, okay. And then we put numbing medicine in your foot. So that's an easy recovery for people. Okay. They go home from the surgery center or the hospital the same day. And most bunion surgeries, we allow people to walk on their foot either the same day or within 2 weeks after surgery. Okay. I would say the biggest complaint that people have after bunion surgery isn't really pain. The biggest complaint most people have after bunion surgery is that their foot stays swollen for a while. Okay. So there's a period of time, usually between 8 and 12 weeks after surgery, where people have a significant amount of swelling in the joint and usually have trouble finding shoes to wear. Okay. So they'll have a special shoe that they wear for 6 weeks while the bone is healing. Okay. And they may or may not be using crutches for a period of time after surgery with that shoe. But then once that 6 week period is over, most people are stuck wearing a wider shoe or a sneaker until the swelling goes down.
And how long is that typical recovery? I know you were saying about 8 to 12 weeks. If someone was to be out of work, how long would they probably be out of work for?
Well, it really depends on what kind of job they're going back to. If I have a patient who's going back to a desk job, I can typically let them go back to that within 2 weeks. But if I have a nurse or a school teacher or someone who works in a factory or a trade who's going to be on their feet for 8 or 10 hours a day, I typically have to keep them out of work anywhere between 8 and 12 weeks.
Okay, all right, so good information to know. So a lot of questions came in around, if I have the surgery to have the bunion removed, is it going to come back? Okay.
That's a good question, and I think that's a lot of that kind of goes back to the idea of like, should I have surgery now or should I have surgery later? And I think part of the reason why when you talk to people and they say, well, my mom had her bunion removed and it came back 10 years later or 15 years later, I think that a lot of that has to do with the fact that people weren't even 10 and 15 years ago choosing procedures the way we're choosing them now. So we've learned a lot about the way we fix bunions and choosing the right procedure for the deformity you have. So we look at the deformity, we measure angles, and we make sure that we're choosing a procedure that will correct the deformity that you have. And if we really choose our procedure based on what your deformity is, we should correct it so that it doesn't ever come back again. And I think when they were fixing bunions 15 and 20 years ago, they weren't putting hardware in people's feet, and they were really only choosing from like 1 or 2 procedures. And so they're kind of like doing the same thing for everybody, and that's why people's bunions are coming back.
So it's definitely a lot about customization this time around. It
Right.
sounds like you can really find the right surgery that's going to be the best fit for your precise needs. So
Right.
then you won't hopefully need to have, the surgery again. Is it
Correct.
possible? So if you would have the bunion surgery on one foot, is it possible that you might need it on your other foot?
Yes. I mean,
At
I
some
guess
point
it
in time.
depends on, everybody's different. Some people only develop a bunion on one foot and not on the other. And I would say it's about 50% of my patients who only end up having the deformity on one side. And so if we know you have a bunion deformity on one side, but you haven't developed it on the other, then that's sometimes when we look at putting, did it happen because you have a flatter foot? So we might want to look at putting something in your shoe as a preventative measure, or that's when we talk about doing other things to your shoes to help prevent something from happening in the future.
Okay. We have someone who wanted to ask a question in regards to going back to the types of surgeries that are there. What is a moderate bunion surgery and what's a severe bunion surgery? What's the difference between the two?
Okay. So if you have a moderate bunion, that's usually what I define as someone who has the bump on the side of their foot and their toe's starting to bump up against the second toe, but maybe it's not underlapping it yet. They still have some mobility in their joint and they have pain, and it's definitely something that's a surgical problem. So that's oftentimes, depending on what your x-ray shows us, the type of bunion that we fix by making a cut in the bone and moving it over and fixing it with a single screw. If we do that procedure, you're able to walk on your foot pretty much right away after surgery. So you go into a surgical shoe, which is a stiff-soled shoe that you wear, and it takes about 6 weeks for that bone to heal. Alternatively, if you have a severe deformity, that's when the whole bone is out of alignment. So we actually see the big toe is kind of bumping up against the second toe or underriding it all the way. The head of the bone or the joint is drifted out to the side, and your whole foot looks really wide compared to the other side. And when we look at that procedure, oftentimes we have to do something back in the middle of the joint, at the middle of the foot. And if we have to do a procedure like that, then we're talking about usually putting a plate and screws in your foot. And for those kinds of procedures, we keep people off of their foot for at least 2 to 4 weeks with crutches.
Okay.
So that's a little bit bigger procedure for people to go through. We usually put you in a walking boot instead of just a walking shoe. And typically it still takes 6 weeks for the bone to heal. But again, there's a little bit bigger procedure, so a little bit more time to heal. And so for most people with that procedure, they'll notice a little bit more swelling. And they'll also notice that after surgery, they're a little bit more limited in their activity for a little bit longer period of time.
And just another quick question in regards to being athletic and playing a lot of sports. Again, I know you talk about it structurally, there's a structural deformity in the toe itself, but I mean, my husband played soccer he's still playing soccer, and his toes are just in horrible shape, and I think it's from his cleats and wearing them too tight.
Right.
But that's something that he says all soccer players do. So
Right.
is that something that have you found over the course of your practice that, some people who, like maybe runners or soccer players, or there's certain athletes that tend to be more prone?
I think
to
so.
bunions?
Yeah, I think so. I think definitely, again, something that we might have seen in someone possibly later on in life, maybe he was going to have these toe deformities when he was in his 60s and 70s, but it just sped up the process. So it's something that we're looking at his foot in his 30s and 40s and saying, oh my gosh, he has these really severe deformities that we wouldn't expect to see in someone his age, and it's just because it got exacerbated by the shoes he was wearing and the activity they was doing at such a high pace at a younger age.
Okay.
Yeah.
Good to know. So we're going to switch gears and talk about hammertoes now. And can you kind of explain to us what a hammertoe is, how it forms?
Okay. A hammertoe is a deformity of the smaller toes on your foot next to your big toe joint, and it's a tendon imbalance. So the tendons either on the top or the bottom of the foot overpower one another, and it causes your toe to pull back and actually sit up. So the top of the joint in most people's cases ends up butting up against their shoe, or the tip of their toe grips against the ground, and that ends up causing them pain.
So hammertoe, is it caused by wearing the wrong shoes, similar to a bunion, or not?
Well, I mean, your toe, the tendons that cause the imbalance are the tendons that help to stabilize your foot when you're walking. So if you're wearing the wrong kinds of shoes, again, like it can exacerbate the problem, especially like in higher heeled shoes. But most of the time people who develop hammertoes, it's because they either have a flat foot or a really high arched foot. So extremes are the things that cause that to happen.
How would someone know that they have hammertoe? What are some of the signs, the symptoms that they should be on the lookout for?
So most people, I mean, you won't notice it when you're sitting most of the time, right? Unless it's really severe. But most people, when you stand up, if your toes are kind of like cocked up and gripping the ground, you'll see it. So like if you stand flat and your toes aren't flattening out against the ground, they're just sitting up like this, and the tips of your toes are gripping the ground, and the joint ahead of the ball of your foot is sticking up in the air, it's kind of stuck in that position, then that means you have a hammertoe. The other thing some people notice is that the joints themselves actually look enlarged. And so some people will refer to that as like a corn or a callus, but that would also be a sign of a hammertoe.
Okay. How are hammertoes diagnosed?
Again, we usually see a physical exam and an x-ray, and that's usually how we make a determination that that's your diagnosis.
Okay. Are there non-surgical treatment options for hammertoes?
There are. We can give people pads to put in their shoes. We can talk about wearing a deeper toe box shoe. We can talk about changing the shoes that you're wearing. But much like a bunion deformity, at some point there's only so much that we can do to modify shoes and put pads on, especially if the fact that you don't have a lot of fat on your foot in that area. Sometimes the bone is actually pressing up against the nerve, and that's part of the reason why people have pain. So putting external pads on doesn't really relieve people's symptoms. Sometimes people will have pain even when they're wearing open-toed shoes. So I have, some patients who putting all the padding in the world still doesn't give them relief, and those are my patients who it's kind of like they're at the point where surgery is really their only option.
When should I consider surgery with the hammertoe?
I think for most people, by the time they come to my office, they're pretty much already considering surgery. Unfortunately, I think most people nowadays are pretty savvy about looking things up on the internet, figuring out what's going on if they're in pain. And a lot of my patients have already tried padding their shoes, wearing a wider shoe. It's kind of common sense stuff. Mm-hmm. So most of the time that I'm seeing them in the office, they're already thinking what can we do to make this pain go away? So considering surgery is really about giving somebody pain relief.
Okay. When should I avoid having the hammertoe surgery?
I think the times to consider avoiding having hammertoe surgery is really for our patients who aren't in good health. Like if we have a diabetic patient whose blood sugars aren't well controlled, or if you don't have time to dedicate to recovery. That's really the biggest thing. People have pretty reliable, good results with this surgery, same with the bunion surgery, if they can give the time to let it heal properly. So when we're correcting a deformity, people always say to me, oh my gosh, you want me to be off of my foot for 2 weeks or 4 weeks to give this time to heal. But the reality is if we're going to take the measures to take something that's not straight and make it straight, we have to give it the time to heal to allow it to remain straight. Because a deformity like this is dynamic, meaning when you walk, it will try to go back to where it was before if we don't let it heal the way it needs to heal all the way. So, and that's why we put a pin in your toe to hold it straight. And that's why we bandage it a certain way and tell you to wear that special shoe while it heals.
And how long is that recovery for hammertoe?
Depending on what we have to do, it can be anywhere between 2 and 6 weeks for people.
Okay.
Yeah, but the average person has to wear a flat, stiff-soled shoe for 4 weeks.
Are there any would they have to do any type of physical therapy or PT afterwards? Is there anything to try to? I know you were saying that if they don't let it heal, it's going to snap right back. So,
I mean, most of my patients don't have to do any physical therapy with a physical therapist. It's just some exercises that I give them to do on their own. And so it's a pretty easy recovery. It's just a matter of, honestly, most people like taking it easy for a little bit of time. And I think that's a hard thing for most people nowadays, like being able to give themselves some time off of work and some time to just sit and let their foot heal.
Okay.
Yeah.
So in regards to the surgery, are there different grades like there could be for the bunion surgery? Is there more?
I think like probably 90% of people who have hammertoes all get the same procedure.
Okay.
So it's called an arthritis, where we actually do something to reposition the joint and then put a pin in it. There's a small percentage of patients who can get a tenotomy, where we actually just cut the tendon and it allows the joint to sit in a better position. But the majority of patients, by the time they're ready to have a procedure for something like this, because it's painful for them, end up getting that surgery where we straighten their toe with a pin.
Okay. What happens after the surgery?
So after the surgery, it's much like the bunion procedure, where it's an outpatient procedure. You go to the hospital or surgery center and go home the same day with that monitored anesthesia. You can walk on your foot right away afterwards in this procedure. You just have a bandage on your foot and a surgical shoe. Most people are usually within 2 or 3 days hardly taking any kind of pain medicine anymore. I think Advil for most people is adequate after this procedure. And then usually within 2 weeks, people are ready to come out of the surgical shoe if they don't have a pin. If they have a pin, it's 4 weeks until they're able to come out of the surgical shoe. But other than just, like I said, giving themselves the time to heal, you're allowed to walk on your foot right away afterwards, and no gym or exercise for that 6-week period while the toes are healing.
Okay. Surgery with hammertoe, is it, once you get it treated, is that the treatment for it? Is it possible that it could come back?
It's very unlikely, because we actually are fusing your joints. So your toes, I always tell people, like, it's hard to explain. I don't know if you can see my fingers, but we're actually taking a joint that bends like this and making it stick straight like this. So you will be able to move your toe up and down, but you won't be able to curl it under anymore. So you'll be able to walk and push off the ground. You'll be able to hold your shoes on because the tip of your toe will bend, but the middle joint where it's crooked won't curl anymore. So once we fuse that joint so it's stiff, it's not going to go anywhere. It's going to stay. And that's why we do that with a pin, because it's a very reliable way to fix it.
Okay.
The reason we can do it to your smaller toes is because you don't really need those to bend to walk. With your big toe, when we fix a bunion, we don't want to fuse it, because you want to be able to push off with your big toe to walk and to run. And that's why we don't fix bunions the same way that we fix hammertoes.
Okay. We do have a couple more questions that came in.
Okay.
So we have a question that says, I've been having sharp foot pain in my right foot. Could this be nerve pain?
It could. So a lot of bunion pain is actually irritation of the nerve on the side of your foot. So a bunion is, can I draw a picture? A bunion is, your metatarsal is the long bone, and then your big toe runs around the side of it. And a bunion is this bump right here. So that's your metatarsal, or the long bone. The nerve runs down the side of it like that.
Okay.
So oftentimes the bump itself is actually pressing up against the nerve and causing irritation there. So a lot of people will report to me like, I'll be fine, I'll just be walking, and then all of a sudden I'll get a sharp stabbing pain on the side of my foot, and that's where it's coming from. There's just this nerve irritation where the bump is projecting out, and that's why changing your shoes causes some relief, because it'll take the pressure off the nerve there. Other times people tell me that their toe will actually go numb over a period of time, because the compression from their shoe causes irritation over the bump.
Okay. We have another question. Do you perform big toe joint replacement?
I do, and that's another procedure that we actually do for people who have arthritis in their big toe joint, not for bunions. But those two symptoms can overlap, and that's why it's always important to take an X-ray. Most of the time when people have arthritis in their big toe joint, the one thing that you can kind of look at yourself and differentiate between is that, and oftentimes you'll have a bump on the top of your joint instead of on the side. The other thing you'll notice is that your toe doesn't move very much at all. So, when people have a bunion, they will still have range of motion in their big toe joint, but when they have arthritis, they usually lose that range of motion.
Okay, so fix that. One last question. So it's flip-flop season, as we know. So flip-flops, are they detrimental to our healthy feet, or use in moderation?
I mean, I wear flip-flops, so I'm not going to say you shouldn't wear them, but I think you just wear them like common sense. I wouldn't wear them to walk around an amusement park all day. I would wear them like when you're, short walks, and then they do make some flip-flops that are better than others.
Okay.
There's a brand called Fit Flops, and they actually have like a contoured footbed and a little bit of a wedge built into them, and so I think those are better than just getting like the $1.99 flip-flops from Old Navy. The other thing is, if you have a really severe hammertoe deformity, you do have to grip your toes to hold the flip-flop on, so that's only going to exaggerate your symptoms. But for my patients who have a bunion and wearing a tight shoe bothers them, then of course, like, it feels better to wear an open shoe, then it's fine to do something like that.
Okay.
Yeah.
Great. All right, so we have come to the end of our chat. Dr.
Okay.
Hurley, thank you so much. This was
Thank
very
you.
informative, very helpful, and we really appreciate that you took this time out to answer our questions. If you have an interest in making an appointment with Dr. Hurley, please call 1-800-8-COOPER to make your appointment, or visit cooperhealth.org. Thank you so much, and we'll see you next time.